Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome back to the Stem Cell Healing Institute podcast. We are here with Dr. Zahra Figueredo. She is the Director of Advanced Stem Cell Therapies here at the Institute. Doctor, how you doing this afternoon?
Very good, Luis. Thank you so much. Always such a pleasure talking to you.
So we do have an interesting topic today, which is stem cells for cardiovascular issues. Doctor, can we mention some of those cardiovascular issues that people may have and may receive stem cells and feel better?
Yeah, so cardiovascular disease is quite a broad condition. So that can signify any sort of issues with the arteries, if there's atherosclerosis or plaques. It can, that's usually what it is referring to, which can lead to heart attacks, high blood pressure, death to the cardiac muscle or the heart itself because of the lack or diminished blood flow and oxygenation to the tissue. So that's pretty much what we refer to when we say cardiovascular disease.
And we know for a fact that stem cells have shown a great promise in the field of cardiovascular. That's basically because stem cells can repair damaged tissue. Is that correct, doctor?
That's right. So the key idea with stem cells is that they can regenerate, they can renew themselves and regenerate tissues, damaged tissues, or any tissue in the body, almost any tissue in the body, that has secreted cytokines or inflammatory markers that specify to the stem cells that, hey, this is where the inflammation or this is where the damage is, because that cytokine is specific for that cell or tissue. And the stem cells know exactly where to go if they are just placed in the blood or close to the heart or at the heart. And so, yes, so we get the regeneration of cardiac cells. Absolutely. And I was referring to arteries and atherosclerotic plaques in the arteries and how it can lead to blood pressure issues, as well as death and infarctions or death to the cells of the cardiac muscle because of lack of oxygenation. And basically how this happens and how the blood pressure issue happens is that these plaques keep the arteries from being able to expand with the beating of the heart, and so they stay narrow, and that's what creates this high blood pressure issue, and that can happen throughout the body. That can happen at the heart, at the aorta. It can happen in people that are obese, that have a lot of fat tissue, where fat tissue isn't very vascular. There is very little blood circulation and blood vessels in the adipose tissue or the fat tissue. And whatever is there are very, very small. So can you imagine a hose that narrows and narrows and narrows down, trying to push water through or any kind of liquid through? And as it gets narrower, the pressure builds. And that's exactly why we tell our patients that if you have high blood pressure or cardiovascular disease, we get the weight down. And not necessarily the weight. We want to get the fat down, is what the body composition, get that changed up a little bit.
So this can actually avoid some type of surgery to clear up the veins, doctor?
Yes, it can. So depending on what the problem is itself, we can possibly avoid the need for bypass surgery if we can clear up the veins and get angiogenesis and a creation. Angiogenesis refers to the production or the creation of brand new blood vessels. Especially what tends to happen is when there are arteries that are blocked in the heart, or at least are somewhat blocked, the blood starts to create different pathways. It takes the path of least resistance. So then that actually helps to create angiogenesis. And in the process of stem cells, the stem cells they enhance this process of angiogenesis quite dramatically. What can happen is with stem cells, we have the ability to create new blood vessels and regenerate new blood vessels. And what that does is in the heart, in referring to the cardiac muscle, what happens is we have the creation of new blood vessels, and that allows for the creation of new heart tissue with the stem cells and the blood itself. And so from an infarct or a heart attack, what we tend to have dead heart muscle to some degree, depending on the degree of the heart attack, where in the heart. So there can be cells that have been, we call it necrotic or necrosis, or death to some cells. So this can literally help to regenerate those tissues that are deficient in blood vessel and blood supply and vitality. So if we put the stem cells right into the blood, they'll go everywhere the blood flows and go right to the area of damage. However, we do that, but we also place the stem cells directly into the circulation of the heart so that we know for sure the stem cells are getting right to the heart. And we do this with every organ. If we have kidney issue, we will put the stem cells right into the circulation of the kidneys. If we have a liver issue, we will do that with the liver. So it's very, very specific. We love the comprehensive idea, the systemic idea of placing the stem cells into the blood so they can go everywhere the blood flows to get a total body effect as well.
I know you use different types of stem cells. In this case, what will be the types of stem cells that you will use?
Yes, so all of the stem cells are always adult mesenchymal stem cells. Those are the regenerative, and they're adult. They're not embryonic or fetal, which is really, really important to us because of the controversy with those younger, more primitive types of stem cells. So we always use adult mesenchymal stem cell, and they can come from bone marrow. We have a proprietary method of expanding or growing the stem cells in vivo while they're inside the patient's own body, so we don't have to incubate them in a lab, risk any sort of damage to the cells or any contamination. And these are brand new, non-toxic cells, and we have the numbers, which are really important. So we will use either a combination of bone marrow, endometrial cells, which are very, very anti-inflammatory as well, umbilical cord cells, and or adipose or fat-derived stem cells. So those are our options, and many times we'll use a cocktail of stem cells to get the best effect, depending on what we're trying to accomplish.
I see. And I was gonna ask you, I don't know if this has something to do with what you do, but do you do any tissue engineering along with the stem
That's
cell treatment?
That's a good question. So we do somewhat of a tissue engineering in vivo while it's in the body. So in our cocktails, we have a very proprietary cocktail of combining certain key factors and growth factors and with the stem cells that literally promote a engineering type of an effect inside the body. So we don't do tissue engineering per se in the lab, but it does somewhat take place within the body.
I need to ask you if is there any risks or limitation as far as the stem cell therapy?
You know, we have not encountered any kind of risk whatsoever. The biggest risk can be risk of infection. Anytime you break the skin barrier, even with an injection or an IV, there's risk of infection. We've had questions about the risk of cancer, so on and so forth. Because we don't use primitive cell lines like embryonic and fetal cell, and we use We do use adult stem cells, which tend to die. And we want that after a certain time. We want them to die off. Otherwise, we would end up with an uncontrolled growth or a tumor, which can happen with embryonic or fetal cells, and that is why we don't use those. And so those are the risks of stem cell therapy, if any. Um, and we haven't ever encountered any kind of complication, thank goodness, with our procedures. Of course, they're done in the most sterile and the most uh, standard, high standard possible way that we can imagine.
I see. And I will ask you this last question, doctor. Can anyone access stem cell treatments? I mean, can anyone be a candidate, or do you do a screening before they arrive? Is there something you should know about the
Oh,
patient before they come?
yes. Oh, absolutely. We do a very thorough workup and screening before a patient even comes to Guatemala. It's really important that we have blood work, we have a history, we start them on somewhat of a pre-treatment protocol. It's really important, Louise, I'm glad that you brought this up, that we don't have a patient with active cancer, and that is what we screen for, among other things, and depending on what we're treating, and so yes, so we do a very thorough workup and history and screening.
So, doctor, why do you do this procedure in Guatemala?
That is a very good question, Louise. Thanks for asking that. Yes, because we have a lot of patients from North Canada and the US, we get asked that a lot. And the reason is that this treatment is not available in North America because of FDA restrictions and Health Canada restrictions. Combining stem cells with anything is considered an unapproved drug. And there is a version of stem cells available in the USA, but it is only autologous, or it can only come from the patient's own body with very minimal manipulation. They can't be grown in numbers or in a lab. They can't be combined with any other component or made into a cocktail or growth factors from the patient's own blood, which really, really limits the effectiveness of the treatment. And in fact, I'm a physician that used to practice in Arizona, and I chose Guatemala as a place to practice very safe and effective stem cell treatments.
And where you are allowed to do the correct treatments, right?
Exactly, and treatments that where we can really make a difference and have an impact on the quality of life of a patient.
All right, doctor, we appreciate your time and your knowledge. Thank you for sharing that with us. So, if you want to send an email directly to the doctor with any specific questions, you may do it by sending an email to info@stemcellhealinginstitute.com. Thank you, doctor, for your time once again.
Thank you so much, Louise. It's always a pleasure.
You
Take
take
care.
care. Bye bye. If you want to contact us at the Stem Cell Healing Institute or Dr. Zahra Figueredo, you may do it by calling us. In North America, you may dial +1 209 690 7836. Also, if you want to write us by WhatsApp, you may add +502 4220 7297. Please send us an email at info@stemcellhealinginstitute.com. And don't forget to visit our website, stemcellhealinginstitute.com. Also, if you like to recommend our treatments, you may find us on Facebook at Stem Cell Healing Institute. Please follow us on Instagram at StemCellHI. If you want to recommend this podcast, please refer to anchor.fm/stemcellhealing. Also, you may find us with that very same name on Spotify. If you want to watch our videos, please go to Dr. Zahra Figueredo, that is on YouTube. Thank you.